Hi there. Good afternoon. I'm with Saskia, also known as Mrs. Worldwide. She leads our CallRail department. The CallRail department listens to calls that come into the practice across the marketing numbers and listens for both the agents, how they're doing on the phone, as well as the conversion of the marketing and the return on investment of marketing. Hey Saskia, welcome to my yet to be named show.
Thanks, Eric. Thanks for having me today.
Yeah. So tell me a little bit about what we call the CallRail Army internally and just some of the insights that you've learned as you've started doing it.
So we've got a team behind us that essentially listens to calls and applies appropriate tags. These are tags that from listening to several hours or quite a few hours of calls, we kind of generated tags that we thought would be relevant and useful going forward. So we essentially listen to these calls and we've learned that we can gather so much about a dental practice, more than just how many patients are actually scheduling appointments, but to how effective scheduling is, how good the receptionists are on a phone. We can even give a dental practice tips going forward on how to improve. And I think we've opened a tin of worms in terms of listening to calls and how much you can learn from it.
What do you think when you listen? Because you've listened to, I think the team has listened to about 70,000 calls, which is an astronomically high number when you think about where we started, 6 months ago.
Yeah.
When you listen to calls, what do you hear the most that just makes you cringe?
I hate a wrong number caller that I know it's a wrong number, and right 5 minutes into the call, that's when we hear it's a wrong number. It's just a waste of time. One thing that just really gets goosebumps on my skin. Or an unfriendly receptionist. Sorry to interrupt. That's another thing.
That shouldn't happen very often, right? The unfriendly receptionist?
No.
Good.
I think it's just if you catch them on a bad day, you never know, but it's a rare occurrence.
Yeah. Now, what do you, obviously insurance plays a huge part in dental today. How are you hearing those questions answered across the practices?
So I think quite a lot of the time, the receptionist asks, straight up, what insurance do you have? Or it's the caller's, primary inquiry that they want to know whether their insurance would be accepted at a dental practice or not. We do have the cases where you have a call and only towards the end of the call is insurance or cost-related inquiries brought up. And I think in order to optimize your answering of calls and your scheduling, it needs to be something that's of top priority. It needs to be something that's kind of discussed as soon as the call is answered. And, if a dental practice is not in network with an insurance, a receptionist needs to prompt or encourage something else, whether it's a membership plan or a payment option. The conversation shouldn't just be shut down right then and there. It needs to be continued.
All right. So what we're looking at is last year's calls. I've filtered it by the new patient tags. Tell me a little bit about the new patient tags and how you use them here in CallRail.
So as you can see over there, there's 3 or let's say 4 tags are the most popular: new patient, scheduled, not scheduled, and financial. Financial includes insurance conversations as well as any price-related inquiries. So we can see over here very easily, we can tell a story from the tags. And I think that's essentially what's been amazing that's come out of CallRail is that 3 tags can easily tell a story about a caller. So we can see financial, new patient, not scheduled, and we can come to an assumption, either that caller had insurance that wasn't accepted, or they were just simply price shoppers who were calling around to inquire about, the cost of specific treatment and compare that with other places. Or maybe the caller wanted a sooner appointment date and that wasn't possible.
So So as a doctor, if you listen to the calls, I could come in here and say, okay, I'm going to find all my new patients calls that aren't scheduled that had financial tags. And then I can listen to them and talk to the front desk about how they should answer them or what we should be doing differently. Okay, that's great. Yeah. And tell me a little bit about this report that you guys, generate from after you listen to the calls.
So while we're listening to calls, we write down notes at the same time. So notes can be anything from a common characteristic that we pick up or something unique, like there's a lot of wrong number callers, a specific solicitor that's calling. But we can go even further to describe a membership plan that we hear, that's talked about quite often. And we can even go further to say quite a few new patients that called in who didn't have insurance found this membership plan attractive, and this prompted them to actually schedule an appointment. So we learn so much on a call by call basis because we are hearing what callers and potential patients are inquiring about or what they want within that dental practice. And furthermore, we then also create pivot tables, and that analyzes specifically the new patient data. So we can see more than just new patients not scheduling, but what other, behavior are these new patients doing? Is there a lot of rescheduling happen? Are new patients canceling their appointments? And we can just learn so much from this data.
Yeah, I really like. One of the metrics that I like the most is I like the total number of calls listened to, the number of new patient calls, and then I like the ones that were scheduled, because I do think over a big enough time frame that this number is probably the most important metric to determine how effective the front desk is performing. If this number's low, which this one is, I would call 32% low.
Yeah.
We know that while the front desk may be friendly, while they may be kind, they're not converting these patients into, or these prospective patients into patients. And we know from Cove that they've dropped a ton of insurances over the last year, and they really haven't changed the way they're answering the insurance question. And Dr. Grantham, Brandon is going through coaching with All-Star and other folks to help improve that, because that's one of the biggest, I think, to me, one of the biggest changes that happened from switching from accepting insurance to not is a call that comes in is easy to close if you accept their insurance, where I think you have to demonstrate the doctor's excellence. You have to talk about the practice and why you shouldn't let insurance dictate coverage when you're a fee-for-service practice. And I think that transition is really misunderstood when doctors just decide to drop insurance.
And you've got to use persuasive language. You've got to have a front desk staff member who sells the dental practice, who, really knows a lot about the dental practice, what they offer, has knowledge that they can explain and persuade these potential patients that maybe their insurance is not in network, but that they really should come to this dental practice for other reasons.